I am Lawal Okikiola. I'm a medical laboratory scientist from Lagos, Nigeria. My poster won the Best Abstract Presentation Award at the ECOWAS Lassa Fever International Conference here in Abidjan 2025. Yeah, the feeling is ecstatic. When I heard the presentation of the award, and I didn't even notice my name was called. The only thing I noticed was Kwara State University was mentioned, which was my university where I graduated from. I was even questioning that, oh, do we have two researchers from Kwara State University here? Obviously, I'm the only researcher, so I was so happy. So this is an emulation for me and for my university too, as one of the best that came out and then bringing us into the international space. Yeah, I started my learning from Kwara State University as an undergraduate, and then I went to Federal Medical Center, Owo, where I had my one-year internship. During this internship, I was able to do diagnosis for Lassa fever patients, and then I saw the rigorous activities and then the pain at which they go through. This was what influenced my research to explore how healthcare facilities respond to Lassa during outbreak. Yeah, I was able to interview health providers and healthcare workers at Iwa Specialist Teaching Hospital and then Federal Medical Center, Owo, to exaggerate on how they respond during Lassa fever outbreak. Yeah, my research found out that most of these healthcare facilities, we have laboratories, we have wards that are available, but then during outbreak we have lower staff, we have low amount of staff that attend to patients. So because during the outbreak we have high amount of patients and then we have low staff. So because of this, I recommended that the government and then the sponsors of Lassa fever should look into providing adjunct staff during this outbreak. They should train adjunct staff that would come in to support the staffs on ground, and then they should provide capacity building for this adjunct staff. Not only this adjunct staff, they should also provide capacity building for our doctors in lower tiers like general hospitals, like private hospitals, so that they can have the knowledge on how to look at Lassa fever patients and then refer them to these big hospitals, because we have a huge knowledge gap in that area. And also I recommended that general hospitals and private hospitals most especially should have a one-room isolation center, isolation ward, where they would keep any patients they suspect of Lassa pending the time the diagnosis will be released, where they would keep those patients so that they would not infect other patients and transmit the disease and then cause outbreak. Yeah. Also, I also recommended that a smooth relationship should be between the healthcare facilities and then the community, because most of these community dwellers believe that Lassa fever is not real, but I'm here to tell you Lassa is real. They believe that, oh, Lassa can be demonic. No, Lassa is not demonic. They believe that, oh, Lassa fever is just for people that present themselves to the hospitals. No, if you stay at home while you have Lassa, it means you are putting your families, your neighbors at risk. So anytime you feel like you have Lassa, present yourself at healthcare facilities and then get treated. Yeah, so I want to appreciate the organizers of this event, and then I want to appreciate them for presenting me with this award. Yeah, thank you very much.